Hi everyone, please come on in so we can get started on time. Welcome to the next seminar in the Research Skills Seminar Series here at CAHS. My name's Sue Scull and I'm responsible for making this happen throughout the year and giving a few myself. And the idea of these seminars is we try throughout the year to cover over 24 different topics that are important to the research process, different aspects of research, whether it's methods or other aspects. And obviously in an hour we can only provide you with an overview, but we do our best to try and keep things condensed because our audience is predominantly very busy clinical people trying to fit and learn about research around the margins of their full-time jobs. So please bear with us as we cram things in, but also note that a lot of effort goes into our handouts, which at the back, beyond the PowerPoint slides, will also have a whole lot of additional resources and also an evaluation form, which we really appreciate you filling in. It takes about 20 seconds, but it provides us and our speakers with valuable input about what you need and what we might change for next time. Please hold your questions to the end because we record these sessions, but also we video link all around Western Australia, so there's lots of people listening in outside and we can hear their questions with the benefit of a microphone. So without further ado, I'd like to introduce Dr. Shirley McGough, who's from Curtin University and with the School of Nursing, Midwifery and Paramedicine. And as you've read from the advertising, she has a wealth of experience across a whole range of different research methodologies, but is particularly skilled in qualitative research. And this is an area which we all need to learn about. It's incredibly important, as I'm sure you'll find out today, and it's often the starting point for research and really complementary to quantitative research. So I come from a quantitative research background, but it's a skill that every researcher needs to understand and why it's so important. So please welcome Shirley, and we'll speak further at the end. Thank you.
Thanks, Sue. Yes, my name's Shirley McGough and my background is originally in nursing. That was my first career. Started off as a general nurse and then did my mental health training, and I'm a credentialed mental health nurse. So I'm a teaching and research academic at Curtin, so a lot of my work is allocated to teaching, and also I have a research component. So although I'm within the School of Nursing, Midwifery and Paramedicine, a lot of the research that we do is across disciplines and across schools within the faculty. So there's a couple of projects I'm doing with psychologists, and I even did something with someone in public health around health and safety, and that was a completely different subject area for me. But what was interesting is that we were able to work together, as Sue suggested, complementing methodologies, particularly mixed methodologies. And although I don't know very much about the mining industry, I could certainly contribute around qualitative methodology. So, yes, it's a great privilege to be able to join other teams, be part of other teams. My background is nursing, as I said, and I consider myself a specialist in mental health nursing. However, a lot of the work I do in research, it spans a very broad continuum of things that come under mental health. My original PhD was in cultural safety in mainstream mental health services, where I'm looking at self-harm, we look at physical health, primary health care. So mental health is really a great area to be involved in because there's so many different ways you can explore, or so many things you can explore. So let's move on to it. So, first of all, I acknowledge the traditional owners of the land on which we stand today and pay my respects to elders past, present and emerging. So this is an overview. There's so much we could talk about, so this is what we'll go through today. Just broadly what qualitative research is and the different types of design. So qualitative is a very broad term and there's so much more to know about individual methodologies, but hopefully I'll give you an insight to what's around. And if you're thinking of doing some qualitative research, what might be the best methodology? Hopefully we'll debunk some of the myths about qualitative research. I've got a couple here, some things I hear, maybe you've heard some others. Talk generally about the research process, how to get started. I think there's sort of this awe and wonder about what data collection looks like and what data analysis looks like. It's all this spooky magic stuff that happens. But there's a real structured scientific approach to it all, and looking at trustworthiness and vigour within qualitative research methods. So I'm not sure where people are as far as their understanding about qualitative research, so I always start at the beginning so we're all on the same page. So I'd like to explain qualitative research as an exploratory approach that's used when really nothing is known about the particular subject area. So, as Sue said, it can often be used to raise some questions, so like explore what the issues are, which can trigger then other research topics and methodologies. But it's very good when we're looking at telling a story of an individual or a group. We want to hear about their experiences, we want to hear about their stories. And with qualitative research, it's about the depth of the information you get from the participants or the subject or the population rather than the breadth, okay? So I say to my undergraduates, you know, quite simply, qualitative research is about the quality, it's about the substance, about the mess, the beauty of data, rather than the numbers. Right, you can tell I didn't do well at maths at school. It's something I developed, but when I heard numbers switch off, I like to hear the stories and try and interpret and understand what it all means. I must admit, as I've matured in life and in my career, I've come again to appreciate the value of quantitative, and certainly do work with my colleagues and in quantitative methods as well. So, you know, why bother about qualitative research? I keep standing back. Normally I like to walk around the lecture theatre. So qualitative research can contribute to evidence-based knowledge in a variety of ways, and one of the ways, as I said, was just to gain a better understanding of the land experiences when little is known. And it's always been a methodology that's been used within health sciences and social sciences. And I think within the medical profession, so I could say that there's been a real appreciation of how qualitative research methods can contribute to understandings, or some are even maybe suggesting that let's switch, you know, in some studies, rather than taking a quantitative approach. The value is seen now amongst a broader disciplines. So there are many different types of qualitative approaches, and I guess the specific methodology will depend on the question that you want to ask. What is it that you want answered? Okay, so if you're looking at, for example, the lived experience of a group, you might be looking at phenomenology, and we'll talk about the different methodologies. So what you choose depends on what you want to know, if you like, and that guides the whole research process then from there. Data and qualitative research is often taken through interviews, focus groups, but also other methods, observations, imagery, photo voice is another new emerging technological approach that's been used within qualitative, cultural text. So lots of different ways to collect data, although we commonly think of one-to-one interviews or focus groups as the only method. Lots of different research designs under the umbrella of qualitative research, and here are just some broad ones. So grounded theory, and I'll talk about these in a bit more detail, phenomenology, ethnography, case studies, action research, and Indigenous research methods, and collaborative yarning is one example of that. So grounded theory is looking at social experiences, identifying what the common underlying social experience is of that group, and also understanding how they manage and work through that experience and factors that are contributing to that. So, for example, my original PhD study was in cultural safety in mainstream mental health services. So what I was looking at was the experience of clinicians working in mental health and how they provided culturally safe care in mainstream services here in WA to Aboriginal and Indigenous clients. So what the aim of the study was, if you like, is to find out what the common experience was. You know, what was it that they were saying about their experience? What were the barriers to provide cultural safe care? What were the things that were facilitating their clinical practice in providing cultural safe care? The common experience, or the common problem experienced by this group, was feeling unprepared. They felt really unprepared to provide culturally safe care for a lot of different reasons, which were identified as part of the grounded theory framework. But grounded theory doesn't leave it there. It looks at ways that people move to overcome that initial experience. So we looked at ways people manage their feelings of unpreparedness and how they move through the phases of becoming a culturally competent practitioner. Phenomenology is looking at the lived experiences. So if you read an article and the title is "The Lived Experience of XYZ," probably phenomenology. Okay. So it's looking at the in-depth experiences of those people who are living that experience. Ethnography, similar but different. It's looking at the experiences or the observations or the cultural patterns within a group, the values and perceptions. And when I say cultural group, I don't mean ethnic cultural group. A cultural group can be a group of nurses, a group of surgeons, okay, a group of people in a particular rural area or mining area. So it's about the cultural experiences, the processes and the values within that group. And quite often within ethnography, the researcher themselves is actually part of that cultural group. So many years ago now, I was looking at models of care within mental health wards. And we were going through the workplace I was working at, we were looking at changing our service or nursing approach because we were expanding quite significantly. So I was a researcher, but I was also actually working in the ward. So we chose phenomenology because I was embedded in that culture as well. Case studies are understanding an individual problem or issue and going back and looking at or trying to make sense of it. And you see case studies quite often used within health science as well, looking at a particular issue and working through what happened, why did it happen. Action research. Action research is when you are working together with a group who are involved in maybe a change process. So the example I gave of looking at changing models of care within a clinical setting, that could have been action research as well, but we chose to use ethnography. Indigenous research methods they've always been around, obviously, but they're certainly getting a lot more they're more in the spotlight from Western researchers because we're acknowledging now the value and the place that it has. So it's looking at a systematic level of inquiry that looks at the experiences, the Indigenous experiences and how they make meanings of it. And it's particularly useful when looking at issues that are occurring within Indigenous groups. And as a Western researcher, I wouldn't choose an Indigenous methodology. Okay, it would be inappropriate, culturally inappropriate for me to do that. Okay, so it's done by Indigenous researchers for Indigenous people, for the benefit of Indigenous people, and it's from the lens of the Indigenous people and community. Oh, there you go. That was what I was reading. So there you go. Another explanation of what the methodologies are. Okay. So, look, I'm very happy to promote qualitative research. I think it's a great methodology to use, and I can probably take any question you have and turn it into a qualitative approach. But there's a lot of misconceptions about what it is and what it's not. So one of the things I hear, or you hear as criticism, is that it's not a rigorous form of research or methodology. It's not systematic. Well, look, any research can be not rigorous and not systematic, but any good research, whether it's qualitative or quantitative, is rigorous and it is systematic. And yes, any good qualitative research or any good qualitative findings will come from very rigorous, systematic and scientific approaches with quite rigid methodology approaches to use. So, for example, if you want to get anything published, anything peer-reviewed, and you have a qualitative methodology, you need to report that within the strict reporting guidelines, but also showing evidence that you've kept to this scientific approach to your qualitative data analysis. And again, you haven't just pulled it out of a magic hat or thrown the data up in the air and thought, well, that's probably what it means. Okay, it's more than that. And I think there's some misconceptions about the rigour in qualitative research because we use different terminologies in qualitative research than they do in quantitative approaches. So often you hear the terms validity and reliability within quant, and you don't often hear those terms being used, which is not to say that we don't consider reliability and validity of data collection and findings. It's just we use different terms to describe that. So we aim for trustworthiness, veracity, consistency, confirmability, and applicability, which is reliability and validity. The other myth we hear is sometimes that it's not transferable to other settings. You can't generalise qualitative research, is the comment you hear. Qualitative research is not designed to generalise to greater populations, okay? Because the data we collect is quite often very rich and we go very deep. And so the findings are quite often specific to the population at hand. It's really up to the reader or the consumer of that research to decide, based on what they've told me about their population and their group and the methods that they've used, how is this applicable in my area? Okay, so we never said we are aiming to mean everything for everyone. That's not the aim of qualitative research. Sample size always comes up. And it's surprising, you know, when you go to publish or you put a proposal in, one of the comments is, oh, why have you only got 30 participants? That's not a very large sample. 30 participants in a qualitative approach is actually quite a large sample. So we're not about numbers, remember, we're about quality and about richness. So sample size, we don't get hung up on sample size too much. What we are more concerned about is data saturation, okay? So what that means is whether I've interviewed 10 people or 20 people about a particular topic, that's not the issue. The issue is, have I reached the limit where when I'm talking to people or I'm talking to the focus groups, that no new information is emerging. There's no new themes, okay? If there's no new themes, it doesn't matter whether I talk to 25 people or 30 people or 40 people, the same themes and concepts are coming up. I've reached data saturation. The sponge is full, okay? Look, Look, I don't hear this very often, but it's one of the myths that I found when I was sort of doing some reading around this, that qualitative research is only useful when it's corroborated by numbers. We've moved beyond that now. Qualitative research can complement quantitative. The approaches can be used together, they can be used separately. One can inform the other. So, for example, if there's really nothing known about a particular topic, you might go in and maybe survey some people, do a quick quantitative survey, find out what the thoughts are, opinions are, and then maybe follow up with a focus group to explore those issues in more detail. Or you could do it the other way around. You could go in broadly to find out what the broad issues are, and then when you've got some themes and ideas, then maybe narrow it down and do some quant. So quite often they're done together, collaboratively, as part of one study or a second study, but both approaches stand on their own. So what is the research process in qualitative research? Take you through these 4 steps. They probably sound quite easy on paper, a lot more to it. But like any research approach, you have to go through a series of predetermined steps. First of all, you need to know what the problem is. So if you broadly want to look at, I don't know, Aboriginal health, for example, what is it about Aboriginal health are you interested in looking at? What perspectives? Who are your population group? What's the question? You also need to be quite clear about why you need to carry out this study. Why is it important that you do this research? What's going to happen if you don't find the answer? What's going to find out to the economics of the organisation? What's going to happen to the health outcomes? You've got to sort of justify why it's important and you must do this research now. What significance will your findings bring? And if you're going for grant approval, you're looking for some money or some payment in kind, you'll have to be really clear about what your purpose is and what you see as the significance of the findings. How is it going to benefit individuals, groups, the profession, industry, the workplace? It's really important that once you've identified what the question is who you need to ask. Okay, so it'd be no good me standing out the front there in the auditorium area and ask to speak to people who have experiences working in Africa. Okay, I may get lucky. Okay, but I'm not going to find the majority of my potential participants or recruits there. So I need to find out who it is I want to talk to and how to go away and recruit people. Ethical approval. These days ethics is getting more and more complex with the more technologies that we use. So we've moved from one-on-one interviews or focus groups. We do a lot of teleconferencing now and Zoom interviews and Zoom focus groups, and you've got to get ethics for all that, as well as ethics to have someone's image on screen and what you're going to do with that image and how you're going to store that image. Lots of things to consider, which is no different to a quantitative approach either. Study design and method selection, which we talked briefly about and we'll talk more about. How you're going to collect the data, and again it depends on what your question is and how you're going to analyse the data. How you analyse the data will depend on the specific methodology that you use, but there will be some commonalities across the qualitative approaches. One of the things that we need to be mindful of, particularly when you're talking with people, whether it be nurses, clinicians, patients, which is what a lot of our research is about, talking to people, is to be able to have an action plan or an adverse outcomes plan. Even a low-risk research, talking to someone about their experiences, can bring up a lot of issues and it can trigger people and you don't know what might be brought up. So even if it's sort of a very bland topic, you don't know how people are going to respond. So in preparing your research approach, before you go and talk to people, you need to plan how you're going to manage that level of distress should it come up. Also, you need to consider how you're going to manage researcher distress. Again, you may think, oh, this is a very neutral topic, but again, you don't know how that may affect you. So I didn't anticipate when I was speaking to a group of people that I would be affected, for example, by their thoughts about their clientele. So what do I do with that as a researcher? What do I do with it as a person? What do I do with it as a researcher is really important as well. You need to think about how you're going to ensure trustworthiness of data, and we mentioned the issues around veracity and data storage and ensuring that the emerging themes or concepts or categories, things that are emerging from the data is truthful and actually based in evidence, if you like. Lots of different steps. We can expand them a lot more. It's a little bit small, but as you can see, some of the key things that may be different in a qualitative approach as compared to a quantitative approach is they talk about theoretical models and theoretical frameworks in qualitative research, and sometimes they're used to help interpret findings, help sort of explain the findings, and this may be quite useful when you're looking at human behaviour, why people respond the way they do, why people maybe aren't following up with treatment plans, why they're not taking their tablets, why they're not doing their blood glucose monitoring, why they're not eating 5 veg and doing 30 minutes exercise. So there may be lots of reasons, but you can use a conceptual framework to sort of look at that data and to manage that. And health belief models are quite often used. Theory of planned change are often common theoretical frameworks used to explain human behaviour within and also within health sciences. So data collection, participant recruitment is really vital because we are quite often looking at humans and human experience. You've got to recruit people and you've got to recruit the right people as well. So who you recruit and how you recruit, what your sample is, depends on the question you're asking. Sometimes we can go out there and, as I said, throw a flyer around and you get some responses. Sometimes it has to be much more targeted and specific. So snowballing is another approach that can sometimes be used. Maybe if the topic is a little bit sensitive or controversial. So if you were looking at something, you know, the health behaviours of IV drug users, for example, you know, maybe, you know, putting a flyer up at work, you're not going to get many participants, okay? But sometimes all it takes is getting a foot in to that community. So once you've recruited one person and you've gained trust, you may say, well, look, I'm still looking to recruit. Are you aware of anyone else that you think might be interested? And they say, well, yes, I've got this group, or I have a support group here, or I know this person. Great. So let's look at how I can try and advertise to that group. So it's sort of a snowballing. One person tells one person tells one person. And I know that I just said that that's often for controversial groups, but I found it quite useful within health sciences as well. You know, I speak to a couple of colleagues. You know, look, I'm doing this research. Are you interested? Oh yeah. Oh look, I know so and so who's interested too. Do you want me to put it in their email box or their pigeonhole? So quite often, you know, that's how it gets done. We often use convenient samples in qualitative research, and that's for ease and timing, and they're available. So, for example, if you're doing a study on the experience of, I don't know, night shift nurses in ED, and you're an ED nurse, there's your sample right there in front of you, okay? Obviously, convenient sample can have its drawbacks as well. There are other approaches to data collection, and again depends on the research methodology, and we can use case designs as well. Quite often we use purposeful sampling, so I'm specifically going to a group, a self-help group, to talk about illicit drug use, because they're the group I want to find information about. I want to talk to them, so I'm purposefully going to ask them. There's nothing wrong with that. That's a valid approach. There's no point going to a childcare centre and, because they're not your sample. One of the things that happens within a qualitative framework, and commonly in grounded theory, is that we have data collection and data analysis happening at the same time or alongside each other. And that can also help us to decide who's our next subsample group. So, for example, you may be looking at the experiences of a particular group of allied health, and so you've done a couple of interviews and you've done some preliminary data analysis. Then you get to sort of 10 and you think, look, what I've noticed is that these are all the things that these people are saying, but what I've noticed is that these are all females, or these are all people that have got 10 years experience. So, to ensure that I'm capturing the experiences of across the board in this group, I'll do some theoretical sampling. So I'm specifically targeting now people who have had less than 10 years experience, okay? Because maybe, the data that I'm finding might be quite different. So data analysis and data collection quite often happen together concurrently, as opposed to other approaches where you collect the data, you go, phew, that was it, and then you do what you need to do to generate results. So data collection in qualitative approaches is probably, you can't underestimate the importance of having a good approach to data collection, because if you don't collect the right data from the right people, then you're not going to have your question answered. One of the things that you need to do as a qualitative researcher is really recognise the value of the human experience that you bring to the study, both the data collection and interpretation, but also be aware of the limitations that can bring. So it's very important when you're starting off, before you start to collect data and start to try and elicit meaning from what you're hearing, is really consider what your assumptions are about a topic. And you may think you have no assumptions about a topic, but we all do. So what is it you know about the lived experience of ED nurses, for example? So you could write 4 or 5 statements about what you believe to be their experience, okay? So you put them aside, you record them as part of your memoing and your note-taking, and as you're collecting data and you're interpreting the data, you need to then look back at your assumptions, and look at maybe the influence that may have on your perspective of the data that's coming in. So how are you viewing this data that's coming in? And also, how does it differ from your assumptions? Okay? And I found that quite often you're not aware of your assumptions and are quite shocked by what people tell you and say, well, that's not what I thought, my assumptions were this. So you need to be able to first identify them, but also manage them, but also understand your position as a researcher, and with those assumptions, how that may influence the interpretation of the data. As I said, interviews and focus groups are often used to collect data, and interviews are such a highly skilled technique. They're really, really important, okay? And it can take you a while to develop skills in being a good interviewer for research. Now, I considered myself, a reasonable interviewer when it came to patient interviews, but it's a different thing altogether. Because if you don't have the skill set, or you don't ask the right questions, or you don't prompt, or you don't pick up on cues, then you're missing information, okay? Missing vital information. So it's a real skill. The example I have I have a PhD student, and she's living in a Middle Eastern country, and she has a position of authority over a health service, and she's interviewing personnel in that area. So to avoid issues of conflict and coercion, she employed a research assistant to do the interviews for her. Okay, so she was removed, and people didn't think they had to do the interviews, and also were not worried about what they said. So she had a semi-structured interview guide that we agreed that was best sort of approach. And but after a few interviews that the research assistant did, it's no fault of the researcher, but we just weren't getting a lot of meaningful data. It wasn't juicy, it wasn't rich. And one of the reasons was that the research assistant wasn't really over the topic. But they knew what the topic was, but the broader issues, and also they weren't necessarily highly skilled in collecting data from interviewees. So that really affected the quality of the responses that we were getting. So this person had to go back, and her and the research assistant spent a lot of time in role-playing and talking about, well, when they say that, that's a really important thing, so don't forget to ask them to follow up. What do you mean by that? Whereas other than just asking the questions as are on the interview guide. So that's what I mean, it's a real skilled technique. It's like interviewing our clients, trying to elicit information about how they feel and their experiences, or how long the pain's been there, or what does it feel like, and when does it happen. It's exploring all those questions. Don't underestimate the importance of the skill of data collection. Lots of techniques that you can read about how to do a good interview or focus group. And it's not about the questions you ask, which is not true. So you need to ask the right questions, but you always start with the interview guide, for example. But it's also what you ask beyond that. And as I said, it's about listening to the key phrases, listen to the tone, listen to the language that's being used. That is all valuable. Okay? So it's not just what they say, what words they use, but it's how they use it. Okay? And it's picking up on what they say and what they don't say, because that's meaningful too. So we're talking about field notes. It's important to collect field notes or memos as you go along. It's to record your experiences, to record your, and also to bracket your experiences as a qualitative researcher. But also, this is part of your data analysis. And this was an early interview for me in this study. And as I said, I put some assumptions aside about the experience and what I thought the experience might be. And then I started interviewing people. And this was an example of the field note that I wrote pretty much soon after the interview. So I said the interviewer was someone who I believed shared similar values to me. It was someone that I knew, not really well professionally, but I did know them. The interviewee spoke of cultural awareness educations that the employer had arranged and was able to discuss some things in this forum. However, they seemed a sterile checklist rather than a real understanding of the issues. Didn't articulate their experience. So for me, it was sort of taking on board what they said and what that meant. And this was a really early field note, but what I came to find was that there was a real misconception about what cultural safety in this example was, what cultural safety was. You know, I'd assumed that people knew. They actually had different ideas than me about what it meant. And this was several years ago, before it was on the radar for the code of conduct for APRA and bodies. I also was surprised about some of the things that they said, because that was not my experience. So it's important that I recorded that, reflected on that, and then incorporated it as part of the data analysis. What does it all mean? Data analysis, huge, another big area, real difficult area. This is where we can become unstuck as well. The issue with qualitative research is that it generates huge amounts of data, huge. So if you've done 30 interviews and they're about 60 minutes long and they're transcribed, that might be about 65 pages times 30 participants. And that's not a big study. So that's a lot of transcripts you've got to wade through and make meaning out of. So it can be very challenging and it can be overwhelming where to start, which is why it's always good to do it in teams. You really have to start at the beginning. Unfortunately, there's no quick way. You've just got to go through, start with the first transcript, read it, reread it, get your highlight and your coloured pencils out, you know, start circling things, start colouring things, you know, what's significant. There may be a lot of blurb and a lot of drawl and a lot of stuff that's really, you know, around the topic, but it's about, you know, circling and trying to begin to code what are these key points that people are saying, okay? So the aim of qualitative data analysis is to get all this data, the mounds of it, and it might literally be mounds, and to bring it down and to give it meaning in 25 words or less, okay? You know, what is the overall issue? What's the overall concern? You might be looking at overall themes, overarching themes, or overall categories. So you have to make sense of everything that people have said and to give it meaning, to communicate, to make a story from it. Make one story from many. So hopefully you'll go from this to that. If you go the other way, you're probably doing it wrong. So it's about, depending on the methodology that you're using, it might be a thematic analysis, it might be just a purely descriptive analysis, or it may be grounded theory, which then looks at generating a theory around the common experiences and how people manage that process. As I said, there's no easy way to start with data analysis. It's going through the data, reading, going backwards and forwards, and even when you've read through them all, it's going back again, okay, and finding connections. So initially it's doing coding. What are the key issues, okay? When you've got 100 codes, what are your links? How do they link together, okay? So you'll find that you go from big data, or big data to big data. You start to look at relationships or how things are related to each other. If you then do some more data collection and you have other codes, well then you need to, and it doesn't fit into the existing codes, or there's not a relationship with those codes, or maybe that's a new category. So even sometimes I'm not sure when I read a paper what approach someone's used, and are they talking about codes or categories? And I think sometimes codes and themes can be used interchangeably or misunderstood. So when we talk about coding qualitative data, it's looking at the condensed meaning of what people have said maybe in a sentence or two or an area. A category is bringing all those common codes together to make sense of it, okay? And themes expresses an underlying meaning. And depending on the approach you're doing when it comes to data analysis and the research methodologies, there are a higher level of extractions. So, for example, coding is a lower level of extraction, and it moves up to themes and categories, and then overarching themes. And again, it depends on what methodology you're using, whether you're reporting on themes or categories. So here's a very simple example of how I sort of move through large bodies of data. This is from a transcript. Again, it was really early. So this is a transcript, and I went through with the old-fashioned. I used NVivo actually to highlight some of the key areas, or the key words that were being used. So she said, not more culturally aware. I don't know a lot, I just don't know. That seemed to me to be important. I thought it was important at the time. I sort of tried to make sense of it. What does it all mean? Don't know, not knowing, don't know. And this then came up a lot in other transcripts as well. So this, I don't know, not sure, really became an important code in developing a later category. And the overarching category was being unprepared. So there was a lot more to the category, but that was one of the things that sort of helped to contribute in building that category. Data analysis, moving through the data and making sense of it, requires a high level of theoretical sensitivity, which basically means you begin to work out what is important and what is meaningful in your interpretation of the data. And that comes from your expertise in the topic area, but also your expertise in the approach as well. So when you're wading through transcripts or interviews, you're looking at what people have said, and is this belief or attitude or opinion shared by others? Is this a common belief? Is this going to, lead to something? So data analysis and qualitative research is not a linear process. You go backwards and forwards, and you think, this is the theme, this is the code, I've got it. 2 hours later, I've got it, eureka. And then you'll go back and you'll test that and you'll say, hang on, well, someone else said this, how does that fit into it? Oh, it doesn't fit. All right, you haven't got the code then, you haven't got the theme. And then so it's going back, okay, maybe dismantling that and going back to the beginning. And it's really helpful when you've got a team of people to go back and forward with and say, well, look, this is what people have said, this is what I think is the meaning to this is maybe the emerging codes, and they say, well, I see that differently, which can be valuable but also very frustrating. Okay. So again, an example of an emerging category. I had a lot of comments around not only just not knowing, fear of not knowing, fear of making things worse. I don't know what to say. Maybe I might say the wrong thing. I'm not sure how I will be, perceived. I'm quite fearful because of my previous experiences in this area. So these were all things that different people were sort of saying. These are sort of things that I was condensing from all the pages and pages of transcript. And that became sort of a code. Fear became a code then for me. Because a lot of people were saying it, enough people were saying it. And that helped to contribute to the emerging category, which is not only the not knowing, but the fear of not knowing. I think I mentioned data saturation earlier. So in data analysis, you keep going until there's no new data emerging. So you could analyse 100 more transcripts and you'll still get the same sort of themes and meanings. And sometimes that can be a test. You can reach your limit and you think you've reached data saturation. You say, well, I'll just do 5 more interviews and code 5 more and see whether, that links back and relates to what I thought it did. And if it does, well, then you've probably reached data saturation. If new information is coming up in those new 5 interviews or focus groups, then maybe you haven't fully explored the data, you've not done theoretical sampling adequately, or you've not analysed the data effectively. As I said, data analysis is no easy way to do it. You just got to start somewhere. And look, there's lots of different ways of managing your data. I just wanted to move to data analysis. Look, back in the days when I was at uni and I was beginning to look at things, we didn't have software that supported qualitative research. So you would photocopy one transcript 100 times. You would have one as a master one, in the highlight areas, and then you would literally cut and paste. Well, this section, okay, and then you'd say, well, this means fear, and then all the bits that meant fear, and this means that, and then you sort of stand back and look at your handiwork, and you have it on your whiteboard or your pinboard and say, actually, no, that goes there, or that goes there. So with technologies and with large amounts of data, thankfully we have software programs which basically do the same thing. They're doing exactly that. They're highlighting, colour coding and putting on a pinboard for you, which is great because you don't have to carry around stacks of piles of transcripts or carry your whiteboard around with you. But it still doesn't do it for you. You've still got to do it. It just helps you to manage the data. And look, truth be told, that I think a lot of qualitative researchers still like to do the old get your pencils out, get your colours out, and because it's a good basic skill, and also it's quite useful when you've got smaller amounts of data. So the point about qualitative data analysis is that it's ongoing, it happens in a non-linear process. There's lots of ways to check the validity and the reliability, so member checks, so that might be going back to the initial participants and saying, and you've already discussed this as part of the consent, the agreement, that look, when I have an early themes that are emerging, can I bring the data back to you and you can just check? So I can say, well, look, these are the key things that were emerging for me from the participants, and they're saying X, Y, Z, and this is their experience, this is their story. And the members may say, look, you got it spot on. That's exactly what I was thinking or feeling at the time, or that's my experience of it. Or, yes, that's very similar, you've captured it here. Or they may say, well, no, that's not my experience, or my experience was very different, or that doesn't represent my experience at all. So maybe that suggests that you haven't captured the totality of the experience. You may go back to your research team and to check. We'll say, well, I've coded it like this, and I think this is the category that's emerging, and as I said, they may disagree or agree, and you may have to then go back and re-look at the data and come to some sort of level of agreement as to what it means. Data analysis requires a high level of critical thinking. Okay. So you've got to look at, even in qualitative data, you've got to look at the evidence, the codes or the themes that are emerging. Where's the evidence that this is the emerging theme? Could it be something else? Could it mean something else? That's critical thinking. This is what I've got in front of me, but how do I know this is true? What are the other ways of looking at it? Which is really important why it's good to have a research team, because you have those other perspectives to check that. And have even a group of nurses, group of health professionals, they see things through different lenses. So if you're not all looking through the same lens, you may get different interpretations. I've talked about data analysis, trustworthiness and rigour. We look at trustworthiness, credibility, transferability. And that's done through using systematic approaches, having your researcher checks and your consensus, so agreeing on the codes and the themes are emerging, having audit trails. So all those field notes and those memos and those journals that you're keeping, that's an audit trail, if you like, of decision making through data analysis as well. And using these structured checklists that they require us to use now when you're presenting qualitative research. So I'm more of the time, and I'll just finish on this. So I think this really encapsulates why I was drawn to qualitative approaches initially. Because it reflects my profession as well, I think. Qualitative research is really a science and an art. There's a real scientific approach that is required so you can systematically and scientifically and rigorously examine the data and give it critical perspective. That's really important, okay? And that's really important for health professionals as well, I think. But there's a real art as well. There's a real art in qualitative research in once you've got the meaning through a scientific approach, is being able to tell the story and to interpret the story that gives it meaning not only to the people who have that experience but to the greater community as well. Okay. So if you can't make sense of it and you can't tell the story, then I think the research point and significance might be lost. So that's it in a nutshell. Provided some resources. People have often asked me at the end of these sessions, oh, what do you recommend? What's a good book to start off with qualitative research? So these are ones that I found online or in the Curtin Library, so I'm sure they're available through your library systems as well. There's your references, but also what I did, great expense to my sleep, is I went through the different types of research approaches and just sort of picked out some key examples of research that was published, and again easily findable, it wasn't behind a few firewalls, that just gives you an idea of the type of study and how they approached it. So there's mine there, there's another mental health nurse, there's phenomenology there, case studies. Again, I picked up a couple that had children in it because I thought this is a children's hospital. Primary healthcare, historical research, looking at the historical account of midwifery in Australia. This one might be a little bit more hard to find. That's a colleague, did that a few years ago. Action research. And there's some examples of Indigenous research. Rhonda Marriott, Sandra Eads, they're all WA Indigenous researchers as well, so it's quite good to see them and read them because they're leaders in their field and also leaders in this type of methodologies. Mixed methods, in case you're interested. A couple of familiar names there for you. Yvonne Holk, Fenella, Gill, Gavin Marsh, Gavin Leslie. Right, if you're interested in looking at different types of methodologies. All right, so thank you.
Thanks very much, Shirley. That's a huge topic to cover in an hour. And I think you'll all hopefully appreciate that just like all types of research, qualitative research has very rigorous methodology, and also you need to work in a good team. You should never be doing research by yourself, and hopefully you can see how big this can be, and putting together a good team with the right expertise is really critical to success in these projects. We've got a couple of minutes if anyone has a comment or a question for Shirley, either here in the room or elsewhere. Does anyone have anything they'd like to ask? Or otherwise, I'm sure Shirley would be happy to stay behind for a few minutes if you think of something. Or email.
Find the curtain, you find the online curtain.
Great. And please take a moment just to fill out your evaluation form at the back of your handout. It's just a few quick ticks, and that really does help us guide what we do. So if there are no further questions now, please join me in thanking Shirley for coming and speaking to us today.